All right, I think I found a good question for probably Lisa here. It's a Facebook question from Whitney. She writes, I'm terrified of having a baby because I heard they cut your vagina to make space for the baby to come out. Is this true, and will my vagina ever be the same again?
You know, we laughing about this, but it's actually very legitimate question, and it can be very terrifying, especially she's already asking this before she's pregnant. But when you're all of a sudden sitting there with that big ball and you think that's got to come out down there, it's very terrifying. Well, we don't typically do what's called an episiotomy, that cut that you're talking about, anymore. We only do it if the baby needs to come out quickly because it's in distress, or if we want to add a little room because we think it has a bigger head and that's what's, kind of holding it up. Those are the only reasons that we really do it now. Because what we do is, as obstetricians or a midwife would do, is they would massage that perineum, that area between the vagina and the rectum, and use mineral oil. Now, you can't always blame it on the midwife or the OB because it can tear on its own, and typically does. And sometimes it can tear all the way to the rectum, so it is a very real fear. This doesn't happen a lot. It's much more rare, but that is actually a reason that a woman can elect to have a C-section if she's had a previous 4th degree or tear through the rectum, because it can have some consequences later for bowel and bladder habits. Ideally, we just want it to stretch and then go back, but that doesn't always happen.
And if you do have to cut it, you sew it back up.
Exactly, and it heals within about, 2 to 4 weeks, unless there's an infection or something like that. But what you have to realize is, you're going to have the most beautiful, precious thing in your life, and it's all worth it.
Hear, hear. Yes.